Though many who do not have hair loss will take this very lightly, some may even laugh at it. But hair loss is a deeply emotive issue, often prompting individuals to seek a hair transplant as a long-term solution. However, despite the growing popularity of this procedure, that is hair transplant, myths and misconceptions about this procedure still abound. And one of the most common concerns I encounter as a hair transplant surgeon is whether the procedure poses a risk to the brain, such as memory loss, dizziness, and many other neurological complaints. In this video, I'll try my best to allay the anxieties, the doubts that you have in your mind. I will first address the anatomy so that you realize how far the operative area is from the brain, and finally shed light on why these myths still persist and why some patients continue to have headaches after this procedure. There is, of course, an iota of truth in patients complaining of headaches, but let's get to the bottom of it. Allow me to unequivocally address these issues. One by one. Hair transplant, firstly, has no connection whatsoever to the brain. It is a surface level procedure which is entirely safe if done by safe hands, safe environments. To understand why there are no brain related risks, it is essential to delve into some amount of scalp, skull and brain anatomy. The meticulous nature of surgery and the robust barriers that exist that separate the scalp from the brain. The scalp and the brain are distinct entities separated by several protective layers. The scalp itself is composed of 5 layers, SCALP in short. Most of the doctors, most medical students know this. The skin, and then comes connective tissue, a layer of aponeurosis, gallia aponeurotica, loose areolar tissue, and the pericranium sitting just above the skull bone. And this layer is about 10 to 12 millimeters thick. Modern FU hair transplant is a highly refined and minimally invasive procedure. The surgeon works exclusively within the very superficial, the top layers of the skin. Hair transplant is not only safe but also highly effective when performed correctly. With advancements in technique and technology, the procedure has become even less invasive, with shorter recovery times and virtually no risks of long-term complications. In a hair transplant, while harvesting or extracting grafts, the punch that we use, which is 3 millimeters in length and 0.8 to 0.9 millimeters in diameter, does not go deeper than 2 to 3 millimeters. So it is pretty much superficial. While making the slits before the grafts are put into the recipient area, the sapphire blade, also with a guard, has a length of 4 to 5 millimeters. While the slit in the recipient area has to be the same size of the follicle, the depth to which the punch digs in the donor area is only about half the length of the follicle, which is about 4 millimeters on average. So do not worry, you're completely safe. And beneath this layer of skin, which comprises of the 5 layers that I've told you about, lies the thick skull bone. A thick and robust bone structure measuring 8 to 12 millimeters. 8 to 12 millimeters in thickness, which serves as a robust barrier, an impenetrable, inviolable barrier between the outside world and our brain. There is no communication whatsoever between the brain, the vessels, the nerves across the skull bone. And then also below the skull bone, several layers called the meninges provide further protection to the brain. This is also 7 millimeters thick. So when we make a puncture while harvesting or a slit before putting in the graft in the recipient area, and since we do not go deeper than 4 millimeters, we still have a distance of more than 2 centimeters before we hit the brain, and which is impossible because of the tough skull bone. And to give you further solace, the skull bone is not penetrable. It is one of the toughest bones in the human body. It cannot at all be penetrated by the instruments that we have at our disposal while doing hair transplant surgery. Neither the punch can penetrate the skull bone, nor the slit blade, the sapphire blade, can penetrate the skull bone. That they have a guard at 4 millimeters depth is another matter. The skull bone, after all, is thick, it is impenetrable, it is inviolable. This structure ensures that procedures like hair transplant, superficial procedures like hair transplant, skin procedures like hair transplant remain confined to the surface and have no impact whatsoever on the brain or its function. Now we go on to address the specific concerns one by one. Number 1, memory loss. One of the most pervasive myths about hair transplant is that you may lose your memory. This misconception probably arises from the proximity of the operative area to the brain in the minds of people who do not know the skull anatomy. Just once looking at a cross-section of the brain, a cross-section of the head should allay all your fears, all your doubts about this danger. Also, memory is a function of the brain's deeper structures, not the superficial cortex. Structures like the hippocampus, which is in turn insulated by layers of tissue and the skull. There is no pathway by which a hair transplant could influence these brain functions. Some patients complain of a feeling of tightness, mild discomfort following the procedure. This is a normal part of the procedure and is temporary and typically resolves within 2 or 3 days. But these sensations are signs of healing of the wound. They are unrelated to the brain, arising due to minor inflammation in the operated areas. Proper aftercare, including prescribed medications, will ensure a smooth recovery. The idea that hair transplant can cause strokes, cognitive impairments, or other severe neurological issues is unfounded. The layers of protection that we have over the brain make such complications anatomically, physiologically, impossible. Additionally, the procedure does not at all interfere with the blood flow of the brain, as the arteries and veins supplying the scalp are independent of those supplying the brain. But why do these myths after all persist? They stem from a lack of understanding and at times misleading information. The scalp's association with the brain, the scalp's proximity to the brain creates a false association leading to unwarranted fears. Furthermore, horror stories about botched procedures performed by unqualified practitioners can also fuel these misconceptions. Clinics using unrefined technique, cheap needles which cost only 1 rupee. Clinics use cheap instruments because of the market dynamics, offering hair transplants at a low price. And these cheap instruments, which do not have a guard, the sharp device go deeper, which can damage underlying nerves. And this trauma can lead to neuroma formation. Well, there are not many big nerves under the scalp, but there are some which are thick enough. You violate their outer coverings, it can cause neuroma formation, which can cause persistent pain, which can last a lifetime. So in the end, I would like to state that hair transplant is a sophisticated, skilled, artistic procedure which is minimally invasive, safe and effective, provided you get it done from the right hands. It requires a deep understanding of the anatomy and aesthetics. An experienced surgeon works with ethics, precision, ensuring that the procedure is performed within the scalp's safe boundaries. And as your trusted clinic, our aim at Darling Buds Clinic in Mumbai and Mohali, India, is to provide knowledge, is to provide clarity, is to provide reassurance besides exceptional care. Rest assured, your brain is in no danger and your journey towards restoring your hairline and the hair on your head is both safe and empowering. So thank you for watching. I hope you're watching the live sessions which I do every day. Those who haven't subscribed, please do. Your involvement with me on the channel keeps the channel going. If you have any questions about today's talk or anything about hair transplant in India, about hair transplants, about hair loss treatment for men and women, do leave a comment in the comment section below and I'll get back to you shortly. Have a nice day and may God bless you.